think I had cancer.
Why would you think something like that?
Well, I looked it up. I've had a cough for a while now. I'd say a month. Sometimes it's got some blood in it. And I'm so tired all the time. But I can't sleep because I wake up because I'm so damn sweaty. And I keep having this terrible chest pain lately. Looked it up on WebMD. Says I have lung cancer. So I'm thinking chemo.
Whoa. I think we need to explore some other options before we look into chemo. From what I see here, your symptoms look a lot more like tuberculosis.
What the hell is tuberculosis?
Tuberculosis, you might also know it as TB, is a contagious bacterium caused by Mycobacterium tuberculosis. This bacterium can cause necrosis of your lung tissue and cause the alveoli to collapse in on themselves. You need a 2-step tuberculin skin test. It might also be called a Mantoux test. Do you understand?
Manitoulin Island? Why do I have to go so far for a test?
He does this a lot. What he actually means is, in order to work towards confirmation of the diagnosis of TB, we will start with the skin test, which is just a small needle just underneath the skin that injects tuberculin and checks for a reaction after 48 hours.
Many unbearable hours later.
That is definitely a positive Mantoux test.
Positive? Does that mean I have the tuberculosis?
Now hold on. A positive TB test doesn't always mean you have active tuberculosis. It may be latent. What we have to do next is use an acid-fast bacilli test and a chest x-ray to confirm it. Do you understand?
Again with the big words. In simpler terms, we're going to take a sputum sample from the patient and then culture it to check for the presence of Mycobacterium, which is actually the bacteria that causes TB or tuberculosis. And then we're going to do a chest x-ray, which will be used to check for any cavities or infiltrates in the lungs, and that usually occurs when a patient has TB. And then the results of these usually take up to a week to come back.
One eternity later.
Yeah, so we don't have any masks left, and that patient's definitely TB positive. It's around 11:30 though, close enough to lunch, right? They can wait.
The doc called me and told me not to leave the room. He said I have the tuberculosis. I'm gonna die.
So the patient has to take a combination of 1 to 2 medications for about 6 to 9 months. It's really important that they take it every day for that period of time. But it is a really long time, and I probably wouldn't expect them to take it every day. So that's a little bit unfortunate. I don't even know how to pronounce the medications, to be honest. I'm really hoping the nurses know.
Yeah, we do.
Yeah, the doc told me about some drugs I have to take. So, does that mean no chemo?
Give her the chemo!
We good?
Record.
A video. Just a... Oh my God.
When do I go? Do I just go?
5 minutes because it's going to get a laugh regardless.
It's gotta be crisp, because we're nurses.
It's gotta be crisp.
I think I'm better with this hand. Actually, no, I'll use this hand. Okay.
The parasonic!
Whoa.